Okay, I'm gonna do some evaluation plans today. Finish off strong. I'm going to attempt to do 3 hours worth of evaluation plans. I'm also going to get back into the infection control, LED, LED, and what else? The microdermabrasion. Well, no, I'm probably gonna do LED, a facial infection control, and what else? It's cold. A few more other things. Let me get some of my materials and go from there. And anyway, so now it is time to go ahead and wash my hands for 30 to 40 seconds. And then I'm going to do first aid in my licensing and client injury. And I'm going to talk through, I'm going to talk through everything with my book. And break my voice as much as possible. And then, recitation. Let me go ahead and read over this whole thing again. Why not? Okay, again, wash your evaluation. And then I have paper towels in here somewhere. Let's see. Alright. So, now. Ooh, legs popping. Alright, so for hand washing evaluation, the total time required to wash hands properly is 20 to 30 seconds. It says to wet your hands under running water. I'm gonna wet my hands under running water. Ooh, that's a little cold. Wash my hands. And I'm going to, it says apply 20 size amount of liquid soap. Rub your palms together. And then it says to rub the back of each hand. Then it says to rub both of your hands while interlocking fingers. And then it says rub the back of your fingers. Then it says rub the tips of your fingers. Then it says rub your thumbs and then ends of your wrist. Then it says rinse thoroughly with water. This one is I didn't do my wrist. I did my wrist. Then dry my hands off. And then it says dry with a clean towel or a disposable towel. Then I'm going to do the implements evaluation. It says to take dirty implements to the dispensary area. So I'll take these tweezers from my work area and make sure I have my barbicide wipes. And also, I also have some other stuff that I can use. And then it says locate cleaning solution. So that will be the detergent. And it says read cleaning solution manufacturer directions. Follow manufacturer directions for cleaning solution usage. Wash implements with warm water and clean solution and scrub to remove debris. So I'm going to fill up my container with 32 ounces of water and put my implements inside the water or in the container and scrub off debris. And then I'm going to put my implements in the water and scrub them off, take them out, rinse them off, dry them off, rinse out my container as well. Then I'm going to get my gloves and my goggles, and I'm going to head over back to the sink and back to the sink, fill my container up with 32 ounces of water. And then after that, I'm going to get my measuring cup and fill my measuring cup up with 2 ounces of barbicide. Double up if needed. And then, sorry, I got distracted. And then, set my implements in my water with barbicide, and then I'm going to time it for 10 minutes. And then while my gloves are on, I'm going to wipe off my work area. So my implements are being timed. And then throw it away. Along with my gloves, and then I'm gonna wash my hands again. And wash my hands for 30 seconds. Need to be careful not to get hives on my hands again, because the soap kind of hurt. Then I'm going to go ahead and dry my hands off. And once my hands are dried, I'm going to get my little manicure head and perform client injuries. So I'm going to get my manicure head. Oh, here she is. So, it's time to get a new one for sure. So, my client is here, and we are in between a service, and the client accidentally got a cut on their chin, and I'm going to say that they should remain calm and don't freak out, and I'm going to have us both head over to the sink, and my client and I are both going to wash our hands for 30 to 40 seconds. And I'm also going to make sure that they clean their wound if the wound is on their hands, but also if the wound would be like on their chin or something, I'd make sure I clean it off for them. So, I'm gonna wash my hands for 30 to 40 seconds. Try my hairs on. And then I'm going to get my gloves. And after I get my gloves, I'm going to put them on. Put my little imaginary gloves on. And then I'm going to get my first aid kit and get some Q-tips or cotton swabs. I know I have some here. Q-tips, cotton swab, whatever. And I'm going to... Ow! Okay, doing too much. Anyway, back to what I was saying. I'm going to get my cotton swab and my Band-Aid and all that other good stuff. And I'm going to take my antibiotic cream and wipe off the room. I'll probably get another cotton swab to use with antibacterial soap and wash off. But then after that, I'm going to take it down over to my client's chin. Throw away the cotton swab. Put a band-aid on the chin. Nothing big. Just like one of these little ones. It depends on the room. Then close it. Alright. Then I'll allow my client to sit back here and go back into relaxing. And then I'm going to wipe off my workstation with a barbicide wipe and wipe everything down. So, wiping off my work area, everything that is touched while I have gloves on, everything that may have blood on it, came in contact with blood, and also, what else I need to do? Disinfect, sterilize, and sanitize everything. Okay. Now I'll throw it away. And then I'll throw my gloves along with my barbicide wipe. And wash my hands again with warm water. Just wash my hands. Dry my hands off. And then after that, I can move forward and do licensing injury. So, for licensing injury, I want to stop the service, explain to my client what happened to myself, and I'm going to excuse myself. And I'm going to go to the sink and wash my hands and make sure I equip the hand washing area with first aid. So, just keep washing. And then turn the water off. I'm gonna dry my hands. And after I've dried my hands, I'm gonna drop the stuff. Oh! Okay. Now I'm gonna dry my hands off, and then I'm going to take a cotton swab or Q-tip and put my first aid ointment on my hands. And I don't have a burn anymore, but I'm gonna still put it on my hands because I don't want it to come back. And then I'm going to take my gloves, put them on, and after I put my gloves on, I'm going to take a disinfectant wipe, barbicide wipe. And after I get my barbicide wipe, and I still have on gloves, I'm going to wipe down my work area. So right down my work area, I'm going to take, this trash, I'm going to take my gloves and throw them away along with my paper towels. My barbicide wipe, and then I'm going to wash my hands again. Alright, so then I'm going to dry my hands off. Hands feeling a little bit dry. And then, once I'm done with that, I'm going to move forward and do what have I done? Oh, it's time to take my implements out. It has been well over 10 minutes, 13, and I'm going to get gloves. And I'm going to get gloves and get my and then go into the container. Wait for a minute. Take out my implements, rinse them off. And then I'm going to take my container and rinse it out. And so I rinse out my container, dry it off. Then I'm taking another barbicide wipe. Starting to think it's drying my hands out. Got my wipe. Then it smells just like alcohol. Then wipe off my work area with my thumbs. And then throw away my gloves with my barbicide wipe. I keep saying disinfectant. Throw away my gloves with my barbicide wipe. wash your hair. And then I can move forward and I'm going to go into doing a facial and doing wax and LED and we'll see where else the wind takes me. So okay, I'll put this in here. And then let me put all this other stuff in here and set up my work area. Okay, so client is set up on the bed and she's ready. And then make room for my laptop if I can. And then what else I need? Water in my bowl. I have instructions on my printer. I have the headband for my client. And I'm gonna put a towel under their neck. And then we put water in my bowl. Alright. So now hot my water, nice and hot, not too hot though. And then turn the light off. And whip up my gauze pads so that I can be ready for my client. Okay, I should be good. Alright, so now, now I'm going to okay. Now I'm going to go over the facial instructions. So it starts off saying greet client and escort them to work area. Determine the client's preferences and assess client's needs. Assess client's skin by performing skin analysis to ensure that there is no inflamed, broken, or raised skin. These papers. And then, where was I? Or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on. It also says, I keep losing my spot. Assess client's consultation form with any medications and products used within the last 72 hours. Consult on any known allergies. Consult with client on any facial surgeries within the last 3 months and the client under physician's care. Assess if the client is prone to cold sores or fever blisters. Assess if the client has used exfoliating or lightening agents within the last 72 hours. So that would be HAAs, BHAs, or hydrocortisone, etc. Assess facial injections within the last 3 weeks, Botox, or fillers. If client is free from the above, the student moves forward with procedure. Then it says washing hands procedure, wet hands with running soap, apply liquid soap. Lather and rub palms to the end of wrist. Back of hands. Oh, so it's telling me to wash my hands. I'm like, huh? Lather and rub palms to the end of wrist. Back of hands to the end of wrist, each finger and thumb for 20 seconds. Rub hands both while interlocking fingers. Rinse thoroughly with running water. Dry with a clean towel and disposable towel. So it says tools and supplies needed to set up are spatulas, gloves, fan brushes, distilled water, comedone extractor. I'm assuming it's like this. Like this. Tip, if you can see. If you can see. And if not, then I got some different ones. But anything like that, I'm assuming. Then it says clean sheets, blankets, client drape, towels, disposable facial sponges, cotton pads, rounds, tissue, cotton rounds, tissues. Headband, hairnet, or head covering. Rubber mixing bowl, a water bowl. Products needed: antiseptic, cleanser according to skin type, astringent or toner, exfoliator, massage product or oil, mask according to skin type, moisturizer according to skin type. And then it says eye product according to skin type, moisturizing product SPF, portion cup or tray. Then it says equipment needed. We're gonna act like it's here. Magnifying lamp, facial steamer, facial bed, stool, hot towel steamer, tray. The preparation of this procedure is disinfect the workstation, bed and equipment using disinfectant wipe. Follow manufacturer's instructions. Check equipment to ensure all devices are safe working order and plugged into the working receptacle. Gather clean supplies needed for the facial. Storing a clean, closed container, and turn on the hot cabbie and stock with at least 3 clean wet towels. Fill clean steamer glass with distilled water. Preheat steamer. Dispense products needed for the service according to skin type and client's needs as follows. Dispense products needed for the service. Prepare a disposable portion cup and for each product. With the portion of product by opening the top of the container. Oh, this is a lot. Drape facial bed using 1 fitted sheet, 1 flat sheet, and 3 towels. Place clean, laundered sheets down on disinfected facial bed. Placing a towel horizontally at the top of the head. Lay a hairnet and a headband on top of the towel first, along with a rolled towel to support the head and the neck of the client. Save third towel to lay across the décolleté. Moving to client preparation. Have client disrobe appropriately for the service. Help client onto the bed. Swaddle sheets over guest. Place third towel over décolleté. Place hairnet or headband on the client's head to cover the hair and ears completely. Place rolled towel under the client's neck to support the head of the client. Excuse me. Then it goes into washing your hands. So, I'm gonna make a mess. So, let's see. Now this is going to take me into cleansing. I realized that's already. Where am I? So now I'm going to cleanse the face. Cleansing the product. Actually, first it says cleanse product to the eyes and the lips. So now I'm going to cleanse the products. Cleanse the face using my products. I had a portion cup. Here we go. Product in here. So before I start, I'm gonna wash my hands. Now, so I'm gonna dip my gauze pads into the water. And, do not mean to get it that wet. Into the water. And then I'm going to go ahead and drain it out. Set it on the eyes. Then I'm going to cleanse the mouth. Going from outward, inward of the mouth. then downward, and go outward, inward. And do the same for the opposite side. Outward, inward. This way. I'm going to turn the heater on real quick. Then it says to what's next? What was I gonna say? I lost my track. Oh, cleanse. So I'm gonna cleanse the skin now. I'm gonna wet my hands. Apply some cleanser on my hands. Rub it in. And then I'm going to come at the neck, moving in the upward movement. Charge my laptop. And up to the chin. Down to the jawlines. Up to the cheeks. Across the forehead. To the nose, across the eyelids. And keep going. And then I'm going to oh dang, I'm gonna cleanse one more time, 2 more times actually. If I put too much on the skin. So I'm gonna cleanse 3 to 5 times, I wanna say that's what it says. I feel like I read that somewhere. On my face. Wet my hands some more. And then I'm gonna do effleurage movement across the forehead. And turn it this way. Then I can remove the cleanser. It's sticky. Wipe this off some more. throw this away. And then I'm going to remove the crimson product, and I'm going to analyze the skin through the lamp. So before I do that, I'm going to put gauze over the eyes and analyze the skin with the magnifying lamp or a loose lamp, checking for abrasions, sebum, flakiness, lines, or freckles. And when I'm finished, I will remove the eye pads. Then I'm going to repeat twice if necessary. Then I'm going to apply toner. So let's just say this is toner. I have a spray bottle. Oh well. Alright. Then I'm going to exfoliate. So with the pea size amount, I'm going to get my brush and go around the skin about 3 times. And hold on. Okay, had a bathroom break. Anyway, now I'm going to apply my exfoliator with a brush. I don't have a brush, but I'm going to act like I do today. So for the exfoliator, I'm going to cover my client's eyes. And I'm going to put a little bit of the exfoliator, actually, and apply it to my client's face, moving in a circular motion, going up. Rub it in for about 2 to 3 minutes. 1 to 2 minutes. I'm just saying different things in different books and stuff. So after I rub that in, I'm going to get a steamer or an exfoliant. I mean, not exfoliant. Facial steamer or a towel. And for me, I'm going to get a hot towel because the beads and exfoliators are hard to get out. And then I'm going to go ahead and what's next? Wring out my towel, test it on my wrist, and then wrap it around my client's face, then remove. But instead, I'm going to take my gauze. One more time. And then throw this away. And then I'm going to extract if necessary. So I'll wrap a gauze around my fingers. Put it in toner. Remove. Firmly. Rub off the blackhead, whitehead, and make sure I do not rub off anything that has blood in the same area as another because they'll give it bacteria buildup. And after I'm done extracting, I'll dispose of my material. And then I'm going to what's next? Let's see. Can I apply toner? So once I do that, I'm going to apply toner. So I'm just keep using water as my toner and all that. Then it says massage. So I'm gonna go into the massage part of this. It says apply 9 size product and I'm gonna rub it in on my hands and start at the décolleté. I'm not reading all that, it's too much. So I'm gonna start effleurage movement going across. Oh, let me get my charger. My laptop. And then I'll do an effleurage movement going across the forehead. Well, actually, I'll go back to the chest and do an effleurage movement and work my way up to the forehead. Then I work my way up an effleurage movement, going up to the chin, down to the jawline, going back up, and then apply some more massage cream if needed, and then go across the forehead. And then over and under, across the forehead. And then I can keep going. And then I'll go towards the nose area and move in my peace sign movement from the nose to the hairline. And then I'll tap around the eyes gently, and then perform friction movement on the cheeks, and then I will rub the corners of the mouth. Then glide across the mouth. And then perform exercise movement at the chin. Going up and down from the jawline to the chin. And then massage with the neck. And then go into the chest. And then the shoulders, into the ball of the shoulders. And then the shoulder blades. So then I'll work my way up, coming back to the forehead, the temples, press and release. And then, let's see if I can do this a little better. Then I'm going to take a hot towel, and then I'm going to test the temperature on my wrist, and I'm going to make sure it's not too hot. And then I'm going to go ahead and remove the massage product from my client's skin. And then boom. I'm done. And then I'm going to do mask. So I'll apply the mask. I'll apply the mask. And then I'm going to let it sit for 5 or 10 minutes. So as I'm letting it sit for 5 or 10 minutes, I clean up, get more product if needed, straighten up, and then I'm going to move the products. And then throw it away, and then I will apply toner to my clean skin, and then wipe it on, wipe it all over. Throw it away, and then I'm going to do a moisturizer, eye product moisturizer, aka SPF. Tap it around, rub it in. Then I'm going to get the moisturizer and rub it in as well. Then press and release. And that's the end of the basic facial. I follow up with my client and give them proper care instructions for the facial, after the facial. Set up the next appointment, sterilize, disinfect, and sanitize. All dirty soiled linens will go in the laundry, and then I'll go from there. Now I'm going to do hand washing, and I'm going to get into the LED lights, or well, LED facial. And let me see. It's my drama facial. Oh, LED right here. So put LED. Oh, there we go. My LED. And then I'm going to wash my hands and start all over with LED. So go ahead and go to the bathroom and wash my hands. So wash my hands for 30 seconds. wash my hands, dry them off, and then with some water, then I can turn on the LED. So now I'm going to turn LED, and I'm going to cleanse the skin first. I'm going to cleanse the skin first, and then I'm going to use the LED. So then here's my instruction. Let's see. So I'll cleanse the skin first. Cover the eyes. And cleanse the mouth. Outward, inward. Then I cleanse the other side. Outward, inward. Then I'll move downward. And then go outward, inward. And then I'll go downward on the other eye. And then go outward, inward. Then I will get some water and cleanse the skin. Get my cleanser and start rubbing at the neck, up to the chin, to the cheeks, to the temples, to the forehead, to the nose. And just do it all over again, about 3 times. And then go to the nose, across the eyes, nose, up, across the eyes. And close one more time. And then I will remove the product off of my client's face. and then throw it away. And then after I'm done cleansing, I'm going to put goggles on my client's eyes. So, some goggles. And then I'm going to put the conductive gel on my client's face. And then I'm going to take my blue light and my red light and wrap saran wrap on them. And I'm going to have gloves on. It says to apply conductive gel, apply often to reactivate the glide of the product. Do not press too hard on the skin. Moving the probe too quickly and not keeping it flat on the skin. In order for using conductive gel will give it less results. Use 2 minutes per pass for each section. This is essential for the appropriate penetration of light into the skin. You may sweep the wand over the skin and hold it to one problem area. So I'll go over the skin. Yeah, just keep moving slowly, making sure I get the whole face. And treating clients with acne and other skin conditions use a combination of the blue and red light. Cover the probe with a clear plastic film for sanitation and protection. After the treatment, use a moist towel on the face to gently remove any leftover gel. So, now when I'm done, I'm gonna take off my probes and then take off the saran wrap, and then I'm gonna wipe them down with this dark side wipe. So after that, I'll wipe them down, and put it back into a safe place. And then it says Do not allow the gel to dry on the probes. If they do, clean with a warm, moist towel. And then that will be the LED treatment. And then I guess for that one, I would go back into the mask and then the serum and then the moisturizer. So, I'm gonna go ahead and just do a mask and wipe off the product. And then gonna remove. And then we're going to apply the mask. With my fan brush, a wooden stick. And then I'm going to allow it to sit for 2 minutes. And time my mask sitting. Okay. And then it's gonna sit for 10 or 5 minutes. No, I can sit for 10 minutes. And then I'll add moisturizer, and SPF. And let's see what's next. And then I got 8 minutes left. And then I can do wax. And so The LED doesn't mention anything else after. So the mask is gonna be next. That's happening now. And then that's it. Then I'll add the serum for the massage portion, then moisturize. And then, yep, go from there. And we've got 6 minutes left. And got my serum and moisturizer. Oh, my skin. Let me get my charger. I've got 3 more minutes left. And then I'll take the mask off. I'm done with that. Alright. 2 more minutes left. Let's see. What time is it? Sounds about fast. And then fake cars. Alright, then we get ready to remove the product from the client's face. Throw it away. And then I'm going to apply eye product. And then massage product. And then I'll be massaging the product into my client's skin. And after that, I'm going to be press and then release. And then I'll follow up with my client, do the proper aftercare instructions, and sterilize, clean, disinfect, sanitize, and go from there. So, yep, that's that. And I'll be back with the next video for waxing.